These are the top 3 reasons that your doctor isn't listening. Hi, I'm Dr. Katie Brown, the CFS doc. I'm a family doctor, and it is, in my own experience as a patient, and from what I've heard from many of my other patients, a huge problem that when you have an invisible illness that your doctor probably isn't very educated in, like chronic fatigue syndrome, it seems like what you're saying isn't heard, doesn't get across to them. There's some barrier there that's just really hard to get through. And today I want to talk to you about things that may be putting up those walls between you and your doctor to kind of help you figure out what you can do to get those walls to come down a little bit and see if you can improve communication between you. Now, sometimes you're just going to need to find a new doctor. We aren't perfect. And as you'll see from these 3 things that I talk about, it is a human flaw that can just make communicating with us doctors very difficult sometimes. The number one barrier that comes between patients and doctors when it comes to communication is ignorance. Doctors don't know everything, but we receive enough training that there are some things that we think we know that we don't. We tend to see all diseases out there as falling into a diagnostic box. And if we don't know that the diagnostic box exists, if we don't know that there's even such a thing as chronic fatigue syndrome or whatever your chronic illness is, and we don't know how to define or use that box or put you inside that box, then we're sort of lost. And we tend to put it into a box that we do know that's inaccurate, such as the condition being psychological in nature, for example. Now, ignorance in and of itself is not a huge barrier. It can be overcome unless your doctor is struggling with one of these other barriers. Barrier number 2 is burnout. Now, physicians in general, and primary care physicians in particular, are asked to see too many patients in too short a time for too long and work too many hours to have the bandwidth to try and problem solve. We know things that we know, we're comfortable doing those things, and if we don't know what we're doing, we send you to a specialist. Now, with some conditions like chronic fatigue syndrome, where no specialty has taken ownership of that condition, then you get caught in this loop, this cycle of being referred over and over and over again and being sent back to your primary care provider over and over again, but never getting an answer. As someone who did my residency in this hospital-based system that is standard for the medical care, at least in America today, I know what it feels like to just not have the time, the energy, the emotional bandwidth to give my patients the best care possible. And that's why I got out, for the health of my patients and for the health of myself. But for you as a patient, you need to be aware that your doctor is not going to have, in all likelihood, very much time or energy to do extra research on your condition, to even do something as basic as a Google search or looking in the literature. They're already so overwhelmed that it can be quite difficult to get time, their energy, their thought process outside of your short appointment visit. So if you hand them a stack of papers or give them a book recommendation, the chances of them being able to go through that resource and take advantage of it is very small. And finally, the third and perhaps the biggest barrier to communicating with your doctor is fear. There's something at the core of every physician that becomes extremely uncomfortable when we don't know how to help somebody or we don't know the right answer. We go through this traumatic training experience where being wrong or not knowing is often a source of shame. And we tend to build these walls, these protective barriers around our ego by convincing ourselves that we are never wrong. This fear of encountering a condition that we don't know how to treat is often a barrier that prevents physicians from thinking outside the box, from considering things they hadn't considered. And this isn't to say that no doctor is, able to admit to being wrong. But I would say that it is a pattern that I have encountered in myself as well as other doctors around me, that we are more comfortable feeling like we know what's going on and the patient doesn't than the other way around. And for that reason, trying to tell your doctor, I think I know something you don't. I think I may have more education about this condition because it's my condition and I've read up on it. And your doctor may not be very open to that. And the reason they may not be open to that is because of this fear. If you want to learn about my top 5 tips for how to more successfully communicate with your doctor, then you can click the card below. Otherwise, like, subscribe, and I'll see you in the next one. Bye.